Yes, yes.
All right. So I think we have few students
Okay.
here who are PhD scholars, particularly who are you can view them perhaps. So we are going to start. So hello everyone. Uh, Good morning, good evening, good afternoon. As our viewers are from different countries, different time zones, so respect that. I, Dr. Apurva Kumar Pandya, Director, Parun Institute of Public Health, welcome you all to our webinar series on public health and healthcare administration. So today we have our expert, Dr. Mudita Dave, who is going to speak on health equity. So let me introduce the topic and our expert of today's webinar to begin with today's webinar. So as we all know that health equity is one of the most often talked topic, and COVID-19 has made this word more popular. So health equity means that people have opportunities based on their needs. An example could be the same, example could be the health center charging fee from people based on their ability to pay, so that we so that the healthcare services can be offered free of cost those who cannot. Health equity can be achieved when every person has opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other social determinants of health. So this is the concept our expert is going to help us understand in the context of COVID-19, and how COVID-19 provides opportunity to work on this innovative way. So it is my pleasure and privilege to introduce Dr. Mudita Dave, who is our expert for today's webinar. Dr. Mudita Dave is a public health researcher, educator with experience studying migration, acculturation, gender, and health. Her research interests include obesity and chronic diseases, global health, immigrant health, as well as interactions between culture, environment, and health. She has experience of teaching public health for undergraduate and graduate students. Currently, Dr. Dave is associate chair for division and chair for MPH program, as well as associate professor at Chicago School of Professional Psychology in USA. She has done her master's. She has in fact dual masters in communication and microbiology, and she has done her PhD in perhaps health from USA. She interacts with students and manages a MPH program. She has experience working in the area of public health in a global context, particularly in India, Peru, Germany, Hong Kong. So she has, you know, experience at a global scale, and she is a member of public health, American Public Health Association, and she's a mentor at Youth Global Citizen. So with this, I would like to, welcome Dr. Mudita Dave to our webinar, and I would like to hand over this webinar to her. Over to you, ma'am.
Thank you very much, Dr. Pandya. It is a joy to share my thoughts and lot of evidence-based data on this very, very important topic of health equity. So without further ado, I am sure we can start, right?
Yes, yes.
All right. So I'm going to make this presentation as interactive as possible, but there will be chances, like there will be some questions that I will pose to the audience, and if you can give me some responses via the chat box, that'll be nice. And then finally, if you have any thoughts to share or any questions, that you can save it for towards the end of the presentation, that'll be great. All right. Okay. So let's see. Okay, so just to have a little bit of an outline that what all will be covered in this webinar. So first, of course, we will start with health equity as an overview, because given the time and context, and then we will delve on. I will share some lessons that we have learned, or are we learning really. COVID-19, the pandemic, it's 2 years. And it has given us a lot of lessons. The question is, are we learning, right? And then, of course, there are some considerations for populations that have been over the globe, right? Have been traditionally underserved. How are we serving those populations better? Or how are we preparing ourselves to serve better, right? And then we'll share some potential solutions that seem to be working. And then finally, we will have some room for discussion. Right? Okay, so to begin with, right? And over the last several years, especially since we've seen like such a unprecedented rise of social media, we see pretty much every other quote being attributed to Einstein. So I'm going to start with a quote that I think is not attributed to Einstein, and instead to the philosopher Seneca, right? So he says that beginning of wisdom is definition of terms, right? So let us start with defining the terms that we are going to try and go over today. So pop quiz, right? What do you understand by health disparity and health equity? Now, in order for us to even try and understand health equity, we must know what is what are health disparities. What does health equity or health inequity depend on, right? Like what feeds into health equity or health inequity, right? So and health disparities is something that does. So I would really encourage you to share your thoughts via the chat box, so I can see what you think about, because oftentimes what happens is these two terms, they are so intricately intertwined that they are used interchangeably, when in fact they are not the same, right? Okay. So I'm not sure if I see anything in the chat box just yet. Okay, I'll give it like a moment or two. Okay, I see participants. And just thoughts, right? Like, again, this is not a quiz, this is not an exam. I just want to kind of engage with those of you who are present, and just basically start there, right?
So we have started receiving.
Yes, I see a couple of yes. So differences in health issues is one response, which is yes, that is true. Again, what we do about those differences, right? So understanding that there are differences, identifying those differences, and then developing interventions to reduce the risks that are posed by those differences, right? So let's go on to the next slide. Okay, so health disparities, right? So again, at least in the US context, health disparity was a term that was coined in the early 1990s, especially around the time that the planning for the Healthy People 2010, the goals of a nation guidelines were underway, right? So initially what it denoted was like health outcomes in disadvantaged or traditionally underserved populations, or racial or ethnic groups, people who are economically disadvantaged, or people with any other disadvantage compared to the population that is not in that same category. So again, formally it was defined in 2010 by federal agencies here in the US, like I said, with the release of the Healthy People Guidelines. As like someone rightly said in the chat box, as differences amongst health in different groups of populations. And I see there's another response in the chat box. Health disparities is not getting equal treatment or care, right? And it also means someone says that everyone has a fair opportunity to be as healthy as possible. Yes, absolutely. Right. So going on, so like many of you shared, health equity is essentially, very simply put, it is said to be achieved when everyone has an opportunity to be as healthy as possible, right? Now, again, health equity is a goal of many healthcare systems around the world, right? Wherein individuals and populations, groups of people, have the necessary and tools that are curated, essentially, and the necessary resources, right? So curated tools as well as necessary resources to achieve the same personal health outcomes. Now, over the last 2 decades or so, significant effort has been put in trying to achieve this goal. But again, it is a very ambitious goal, right? When we think in context of large populations, as the case is for India, or many countries in Asia, South America, and many parts of the world, right, including the US, right? One would imagine that everything would be fair and equitable in the US, then that is not really close to the reality, right? And I will go into some context related to health equity in the US as well, towards the later part of the presentation, just to give like a compare and contrast kind of a view, right, of health equity. All right, so it is very interesting, right? So what really affects, so what are the factors that really feed into achieving a status of health equity, right? So again, there are broad factors, deep factors, very deeply rooted factors of social justice, socioeconomic factors, and factors what we know as social determinants of health, right? All right, and then of course there are other factors. We'll go into some of the factors as we go, right? So coming on to the pandemic and what we are learning. So these are observations, right? The very fact that health inequity is real, right? It is seen in India, it is seen in the United States, it is seen pretty much everywhere else on this planet. So there are gaps, right? So there is one thing called the goal, right? A very ambitious, lofty goal that health systems and nation states may have for themselves. And then there is a reality, which is not close, which is really far from the goals, right? There is movement, there's a lot of work that is possibly being done, but there are gaps, really very real gaps between what we would like, the state of our health equity, and what we have currently, right? Now, the interesting thing that the COVID-19 pandemic has been teaching us is that it is really most critical to address the gaps in health equity before any emergency situation, before any epidemic or pandemic strikes, right? It is a work in progress. Now, again, what happens every day matters, right? In terms of building capacity, in terms of allocating resources, in terms of really having a very stringent mechanism in place to assess, right, where we are. Because really, unless we assess where we are, whether we are a small village, whether we are a small town or a big city or a large country, assessing where we are in terms of the measures and the metrics associated with health equity is vital, right? So we also have a lot of evidence from the pandemic letting us really know in our face that those who are most vulnerable in our communities they need the most support, right, in order to limit the damage impact that the pandemic can and has brought on, right? So again, very, like I said, there are a lot of factors associated with a number of social determinants of health that feed into health equity and health disparities, right? So it is very clear that health equity mirrors other inequities that people face in their lives, right? So what we have also learned, nevertheless, from the COVID-19 pandemic is that even though there are social determinants of health that that may divide people into different strata, right? High income, low income, people around education, highly educated, and otherwise. But the pandemic really did a reality check for us that we really share our humanity with people, other humans, right? That we are quite vulnerable. Now, again, that level may vary, right? Because of a lot of unequal access to care, nutrition, access to education, all of those different factors do moderate that effect, but then we still share share humanity with people across socioeconomic divides and other race and ethnicity, class, caste, gender, society related divides, right? So the primary drivers, essentially, of health outcomes, the social determinants of health, really shape a lot of factors that that essentially are related to how we respond to COVID-19 or any other, really health scenario, health challenges, right? Okay. Okay, so oftentimes I get asked by my students here in the US as to how are different countries responding to the pandemic, right? And then you may have seen in the news that there have been like really the pandemic has been fraught with a lot of divides, not only in the sense that people have different access to care, cost of care, quality of care based on where they live, who they are, how much they can afford to pay. But we have also seen like some really broad in the face differences between a collectivist society like, say, India, or an individualistic society like the US, for instance, right? Now, of course, the pandemic really was exceptionally challenging for all the countries of the world, right? Because it really did not differentiate. But collectivist society like India, in my assessment, have had some silver line, right? And there are many, right? People going out of their way to help not only their family and friends, but neighbors, community members, people in the the same neighborhood, same community, however one defines one's community. But then, other than that, right? Even though being a democracy, US and India, that's something that they share, but the way that the government and individual liberties are managed and given to people. We had a huge divide over mask mandates, over vaccinations, and government is usually not very comfortable in mandating people to at least in the initial part of the pandemic, to wear masks or to vaccinate. And as a result, we had a lot of divides, right? A lot of, you know, not so pleasant debates, a lot of confusion, even for not only for individuals, but for companies as well, whether they, you know, could mandate masks, mandate vaccines, and whatnot. But in countries like India, government is a lot more comfortable in mandating directives, guidelines, about mask requirement or vaccination requirements and things like that, and that also uh, could have, right, and time will tell us whether how effective that was, and how how it kind of led to unforeseen consequences, because we definitely know that the initial lockdowns had a lot of challenges that were imposed on people, especially the most vulnerable ones, the people in our communities um, who worked as as a daily wage laborers, for example, people who were working as migrant workers across the country, and the challenges that people had in the very initial phase of the pandemic. But again, this is something that that we see, that that's a difference between, again, there is no right or wrong that we can ascribe in many things, but it is an observation for us to think as professionals in public health, or as researchers and educators, and as students, that there is merit in looking at things as they unfold in an objective manner, right? So that is something that is an observation that I had. Okay, so when we think about health disparities, right, we have to think about diversity. We have to think about different aspects of diversity, right? So in the context of India, of course, there's many layered diversity, right? So there is not only a diversity based on the standard parameters of diversity, like that we have in the US or other places in the world, like race or ethnic groups, language, income, education, geographical location, gender, and so many other determinants, demographic factors, right? But linguistic diversity is also very, very important to understand. And again, we have to remember these are just the major languages, right? This map here on our screen does not factor in thousands of dialects, right? So how do we, now we want to understand, how do we essentially address communication issues? How do we address factors of access to care, factors of access to testing, vaccination, and any other not only pandemic related care people need, but healthcare in general outside of a pandemic, right? So do we have adequate material published and made available to people where they are, right, versus where we think people should be, right? So do we make sure that our machinery, our system, healthcare system, is putting out communication through the channels that people really are receptive to, that people prefer in? How do we do that, right? In the scale that the pandemic really needed us to provide. So again, this is one aspect of diversity, linguistic diversity, which kind of really leads into other factors, right? Again, making sure that we have people like caregivers providing language appropriate care, understanding what the patient or the recipient or the consumer of healthcare communication, for instance, or even healthcare, right? Because patient-provider interaction is so vital, and is being provided in the language that people understand, people are receptive to. Again, those are the factors that I would really want you to think about. Okay, so there's this concept of social vulnerability that I wanted to kind of just touch upon, because we understand social determinants of health. We talked about, how unequal the playing field is. And our effort as public health scholars, public health educators, public health students, public health professionals is to essentially help make that playing field a little bit more even, right? So again, social vulnerability. Now, a lot of places, at least in the US, use what is known as a social vulnerability index to really understand and assess risks posed by a lot of social determinants of health and factors that we will go into in just a moment. But I won't be going into too much detail, but I wanted to touch upon this because just so that we kind of look at it in the context of the pandemic as well, right? So of course, there are natural and human-made disasters, right? Wars, disease outbreaks, pandemics that we see, and unfortunately, we see them as we speak, right? So there are, like I said, variables and factors such as race and ethnicity, language, like we saw, but also medical vulnerability or issues related to access to care, cost, and quality, as well as healthcare infrastructure, right? Again, an example of healthcare infrastructure is something that we see oftentimes, and I trust that you see it in your context as well. Because see, it's one thing to have a lofty national healthcare policy, but it is quite another thing for rural healthcare centers to not have adequate staff, for instance, healthcare providers, whether it's doctors, nurses, lab technicians. These are key resources that are needed to really put a lot of momentum and a lot of groundwork towards attaining the lofty goals put forth by healthcare policy, right? Whether at the state level or national level. Now, other than that, of course, is a huge factor of socioeconomic that comprises a lot of social determinants of health factors, right? Health, education, income, but also household composition, status, right? Language, housing, and a whole lot of factors that you can see on this screen. Okay, so why should we be bothered with social vulnerability and work towards reducing it, right? It is quite intuitive. One can really easily imagine that reducing social vulnerability can decrease not only just human suffering, but also economic losses. So that for some of you who are students of not only public health, but also healthcare administration, this is also very important to understand, because healthcare systems also need to be robust and healthy, right? Economically as well. Okay, so again, what are, like, just to summarize, right? If you just logged in, what are some really increased risks related to social determinants of health and the ability to really weather out a pandemic of the scale and scope that we I want to say, are at the tail end, right? So again, if you're poor, if you live in rural areas or tribal areas, if you are marginalized in any way, if you are disabled, and if you're living with chronic conditions, right? So these are some of the heightened risk factors that really are important to address. And these kinds of things are, of course, in a pandemic, everything kind of becomes, the focus is to really address the immediate thing, right? To make sure that people get the required testing or treatment, access to care, nutrition that they need to come out healthier if faced with COVID, and as faced with the challenging conditions other than just the infection with COVID-19, right? But these are the factors. These are the very, very important areas that should be focus of our work on just a regular normal day, because that's when we bring our best self, right? When at a community level, at a national level, when we are faced with unprecedented challenges such as this current pandemic, right? Okay, so now comes the $1,000,000 question, right? So health, as we know, depends on way more factors than just healthcare systems, right? So I would really like for you to, I'll take a pause and I'd like for you to share with us, what factors do you think impact health other than just access to care, cost of care, quality of care? So I will be looking at the chat box for your responses. I see some responses here. Let's see. So okay, I see some, again, some thoughts saying that, this is not possible. Why are we talking about health equity? Environment, power dynamics in family. That's very good point. But also genetics, behavior, environment, physical influences, medical factors, and social factors. Who decides? Financial security. I'm really glad to hear all of these thoughts. Okay. Okay, so the reason, and again, one may feel it's very, very natural, I would say, for people to feel disheartened because of the kind of unequal world that we live in, and that's true, right? We would be kidding ourselves if we denied that, right? That said, the goal of public health is to make sure that everyone has a good chance at living the best life that they can, right? Very, very simply put. And hence, all of our efforts to make an unequal world just a little more equal, right? Just to take that steps in the right direction, right? So it would be befitting us that we conducted ourselves as public health professionals, as medical community, as people working in other healthcare professions, or in other disciplines that impact health, because it is not just doctors and public health professionals, clearly, right? That's one truth that we can all potentially agree on, because there are so many factors, right? You do not even have to be a professional to impact health in a family, right? What it takes for us as humans, as family members, as friends, as community members, as educators, as people with a responsibility to make sure that in our own realm, we we walk the talk, or as they say in the US, where the tire meets the road, right? Where there is alignment between what we think, we say, and we do comes in, it comes together, right? So I see some more responses. I'm going to check them out as well. Economics, financial security, our own awareness, socioeconomic status. I see whether health is felt need or not. Security of the country. Oh, absolutely. Biological factors, I would imagine. Education, absolutely. And I'm really, really happy to see all of you engage, because that's the first step, right? Okay, let's see. Okay, now again, health outcomes are also impacted. Now, these are some other factors by representation, right? By having representative voices, not only in health research, but also in media portrayals. The interaction between culture, which is like the area that I am actively involved in understanding, but also in really demystifying a lot of stereotypes, a lot of, breaking the biases, right? So those, and these are a lot of times very deeply held, and again, big issues as far as, social justice is concerned. So we want to address all of those factors that make social justice a lens through which we can encourage people to look through, right? Because we often look through lenses which are not converging with social justice, right? Lenses through just facts and other very important things like what we see in terms of numbers, but we have to understand the stories that feed into numbers. And hence, as a researcher, I really always advocate for mixed methods approach to research, because that's when we see the why behind the numbers, right? So I'm going to share very quickly, and I'm mindful of the time. I know we started a little bit late, but I'm going to quickly share, how advocacy and how having a voice and sharing it with others can potentially help, right, in health equity related context. So you may know already that health disparities, like I said, exist everywhere on the planet. Not that it is something that one should be proud of, but we should be actively focused on addressing, right? So the case of Asian Americans in the US is quite unique. Now, Asian American group, now that comprises of people from across the Asian countries. In the world, 60% of people can, they identify as Asians. But in the US, about 6% of people, between 6 and 7% of people identify as having Asian American heritage. Now, even though the percentage is low, it is the fastest growing population group in the US. A lot of stereotypes, a lot of myths, and a lot of challenges associated because it is a very heterogeneous group, right? It comprises people from the countries of India, China, the Philippines, Bangladesh, and many, many other Asian countries, as one can imagine. Now, even though, largely speaking, Asian Americans as a group enjoy higher incomes, higher levels of education, there are health-related issues where there is historically that, even though they're perceived to be healthier, Asian Americans, there is evidence pointing to the fact that they have disproportionate burden of certain conditions, such as, let's say, as you can see, hypertension, type 2 diabetes, asthma, and some others. So again, it's important for us as researchers in public health and healthcare to understand the factors and work towards solutions. So this is one example. Now, the other example is, how do you know of a problem if you do not try to understand it, right? So it all starts with having accurate data. And and the very first time in my knowledge that I've been in the US in the last like 20 years, 20 plus years, that for the census 2020, we started um, providing uh, materials, communication materials in languages other than English and Spanish, and some other languages that we had resources for. So I had the privilege of working with for the Census Bureau to translate some resources for participation in the Census 2020 in the US in Gujarati. Right. So again, it is upon us as community members, as public health professionals, as educators and researchers uh, to essentially engage with the larger systems and advocate for the resources that we need. And it really speaks a lot about the vision that you have for your community, right? So we have to, like I said earlier in the presentation, that we have to meet people where they are, right? One may imagine that every one in the US would understand English. Well, that's not true from the perspective of people who do not speak English as a primary language, right? So it was a very, very interesting experience. And hopefully helpful as well for people who speak languages other than English, Spanish, and some others, which had traditionally resources provided to them. And so if you look at inclusion, because the equity does not exist by itself, or should not exist by itself, it has to have an inclusion of community, of population groups that are traditionally underserved or underseen, I want to say, right? So look at this communication material. This was published by New York, state of New York, or city of New York, actually, for the census, right? For encouraging people, South Asian population in New York to participate in the census 2020, right? And then this is an example of inclusive communication, right? If I see people like me in the ads, I'm more likely to believe that, okay, this is something that I should do as well, right? So this was an ad that I was involved in translating from English to Gujarati. Right, and this is just like one part of the campaign that was done in a lot of other Indian languages, including, of course, Hindi, but also Gujarati, Telugu, Tamil, Marathi, Urdu, and others. Right. So again, as community groups, as community organizations active in the U.S., making sure that access to information is also equitable. Right? So again, the CDC here in the US has given 5, broad actions to promote health equity during the pandemic. But then again, it should not be limited just during the pandemic, right? So making sure that we educate people and in culturally sensitive, culturally competent ways that resonates with everyone, right? So creating public service announcements like I shared in previous slides is one way, but also include outreach to gatekeepers in the community, people who hold positions of power and influence, right? And so that reassure communities that they can count on health systems, right? They can come to the hospital and they'll be given the best possible care, right? And one thing that I often see is undervalued and undersold is leveraging community partnerships. So in the pandemic, we saw that many organizations, whether they are healthcare, medical, or social organizations, they're better, or the response to the pandemic is better and more equitable if they really leverage those partnerships to strengthen prevention efforts, right? For instance, community health workers distributing not only education material, but checking on people. That is something, oftentimes what happens is stories of success are not told well, right, or enough. So we had a lot of challenges with people following up with in the US with people who were tested positive with COVID. On the other hand, I know not only anecdotal evidence, but accounts from places in Gujarat, for instance, who did a very good job of following up with people who were tested positive, and helping families through a lot of different challenges associated with COVID. Community health workers, but also other voluntary organizations, right? So leveraging those partnerships, then bolstering efforts to collect and use patient data, right? So that is something that is so vital, as we saw for clinical care, for providing medical care, and to make better decisions, how to allocate resources, where to allocate resources, how to tweak midway, because things are very dynamic in the field. And then finally, making sure that we have increased availability of testing, and to also make sure that treatment is equitable. And now that is a very, very contentious point in a lot of different contexts around the world, because we see that in certain cases, treatment has not been equitable. And how do we make sure that we take that initial steps to making it equitable, right? So it starts with like how we function without a pandemic, right? And then of course making sure that we share the best practices, the lessons learned. We make sure that it reaches all the stakeholders, right? The lessons, the best practices, but also guidelines, right? So what we do now, when we are at the tail end, and I'm like knocking on wood to say that yes, we are at tail end of the pandemic, right? That we do not become, we just do not throw caution to the wind, and we really institutionalize the lessons learned, right? Across board. So again, this is an interesting graphic from one of the peer-reviewed journals. And this is, of course, in the context of Asian American health outcomes, but it could be adapted for pretty much any community across the world. We need these 5 very important pillars, right? Of course, the clinical care that we provide and the resources that we allocate, the advocacy that we do for informing health policy based on our learning from the pandemic, and the related resources in not only just funding, but human resources as well, that are poured into the community. But what is also important, that we have enough and emphasis on education, right? So empowering healthcare facilities, universities, and centers of health, public health departments, because what has really come forth is that across the world, public health departments and public health infrastructure has been chronically underfunded, right, and undervalued. But the pandemic really brought us, I want to say, to the point that we're actually very cognizant of the fact that we for any country to really function and public health, a strong, robust public health system is needed. What, of course, as we know, has happened over the past several decades is that, curative medicine, right? Curative care has received a lot of attention and resources versus preventative services. And that shift has to be made in the way we not only prepare students and professionals, but also how we put in the resources, right? So that is one other observation across, both in the context of the US as well as India and many other places. So again, this is another action plan that is very, very, it's generic, but it can be adapted to any particular context, right? So that is also, in the interest of time, I'm just going to not really delve deeper into it, because I also had some potential solutions for health disparities, but I'm going to focus a little bit more on what we can do, right? As in our individual and collective capacities, what we can do, right? Like I said, set very healthy examples of health behaviors, promoting and following guidelines in the context of local community protocols. How can we essentially support public health efforts against COVID-19? Then, of course, we as individuals or as members of whichever social group that we identify as, we can, join the effort to make sure that people we come in regular contact with. So in the context of, again, this is like a reflection for everyone to do, is whoever we come in contact with, how can we try and help people get access to resources and maintain and manage physical as well as mental health. And I didn't even, cover mental health, but the pandemic has, as we all know, has had lot of impact on the mental health of a number of communities, right? But especially those who are most vulnerable. Right. So it is our responsibility, because again, we have a lot of privilege that we can, and in my opinion, must use responsibly to really further the cause of health equity, because otherwise it's lot of words shared, lot of ideas shared, but when it comes to action, it really what really matters is what we do, right? As well as what we hold our systems accountable for, right? So and then of course, making sure that we address unintended challenges, right? Aspects of emotional well-being, social connectedness, social support, because a lot of groups, right? Young children who've had to do, online schools, with very limited physical avenues for being physically active, the elderly who also have been cooped up in their homes. All of those have kind of brought a lot of deficits related to physical activity, related to not only physical health, but also emotional well-being. So again, we want to be part of the solution to address those challenges, right? And last but not the least, empower and encourage people to protect themselves, right? Care for those who become sick, and make sure that, those who are most vulnerable, not only kids and the elderly, but people who are disabled, to help them cope better with stress, right? Again, so these are just a few solutions, few strategies that what is under our realm of possibility that we could do, and I trust that we all do, right? So again, encouraging and empowering people that we come in contact with, because clearly if we are listening, if we have access to a computer and internet, and we are if you're listening to each other right now, we have some privileges that we want to definitely try and use better, right? So with that, I had a slide for some silver linings, because again, I want you to really see that the glass is half full, right? Versus it is easy to get dejected and disheartened, because we can talk till the cows come home, but what about tangible action? So again, think about the Spanish flu, or the earlier, like 1918, for instance, to 2022, right? It is heartening, in spite of all the odds that we face. in the realm of health disparities and health equity, we have come a whole long way, right? So when we put our collective strengths and collective abilities to solve a challenging mammoth problem like the vaccine problem, we were able to, as humankind, we were able to do that like in a matter of, under a year, matter of months, right? So while I say that, I also recognize that there are very real challenges of an unequitable world. They've also amplified, right? Now, we have seen a lot of challenges with access to vaccines in many low-income countries across Africa and Asia. So we have problems. Like in public health, I often share with my students, so like we do not have a dearth of problems to focus on. So that should definitely keep us going. And to recognize that we are interdependent, right? Not only at the level of the family, community, colony, society, nation-wise, but globally, we are interdependent. And to recognize that and to get energy from that fact to move forward, to make the playing field just a little bit more even. That thought is, I think, very energizing, right? And we need all the energy and resources that we can, because it is definitely an uphill battle. And we don't know right now. Time will tell, right? What more challenges COVID-19 pandemic has created for our communities. With that, thank you very much. And I will take a pause. If you have any thoughts to share, any questions, I'll be happy to answer.
Yes, Dr. Dove, thank you very much for your wonderful presentation. Your examples are in fact very useful, and you made complex concepts so simple and easy for our students. So I think that was commendable. I have already received few questions. So before the participants or students who are here in the group, I would like to raise few questions and followed by the students who are here online who can unmute themselves and ask. So I have received 5 questions. So
okay.
six questions so far.
Okay.
So yeah, so one is very basic question about the terminology, the term health equity and inequity. So which one is better to use when we talk about public health program? So is it one is derogatory or another is, it looks like exactly opposite, but which term should be used as a public health professionals in our work?
Yeah, so thanks for the question. Again, the usage of term really depends on the context, right? And the problem that you're trying to address, it really depends on that. But we generally, the term that is used in public health, at least, is health equity, because that's what we are striving for, right?
Yeah. Yes, I think that's important aspect. And extension to that question is that yeah, it is very important to keep equity as a goal of any public health program. How exactly we can integrate the equity in public health program?
Help me understand the question better. The question is, how could we possibly integrate health equity into a public health program, as in an intervention or a program?
Yeah, I think as an intervention, okay. How can we, because equity doesn't come on its own. We have to strive for it. So apart from the researches that we do, what is required as a public health professional?
Yeah, that's a very good question, and I know that again, there is no easy answer, but the very fact that we want to, as public health community, we want to make sure, and again, we cannot do that by ourselves. So people from healthcare and medical community also have to have, it's first about having a common vision, right? Of having the vision to see the world as an um, as an equal place. So infusing equity at every step has to be part of the unified vision. Whether you are a educator, researcher, or a physician or a policymaker, you have to have that vision of equity, right? Because a lot of times what we see in our work is that people feel that, if they're born with privilege, they think that it is their privilege to have that. It is their birthright, rather, to have privileges, um, and that other people are supposed to be subservient to them, which is not the case. But again, how do we engage with people? The idea is to engage with people amicably, right? Without again, most work gets done, at least in my experiences, when we engage with people and share our worldview, right? So if we have a worldview of equity, how can we uh, share with people where they are, right? So it has to be part of everyone's vision in terms of, so that's the reason that when we talk about collective vision, right, we have to make sure that health equity is infusing that vision of whether it's better healthcare system, better transportation, um, better nutrition, many different elements, right? And it doesn't even start in a hospital. It starts at home. It starts in our communities, starts in our social welfare programs, right? So to have a lens of health equity, that everybody is entitled or should have equal access to healthcare, for instance, to kind of really put it in out there in people's minds, right? So all of us, I think, have that responsibility of taking that vision to as many people that we can. I hope that answers the
Yes, I
question.
think yes, and I think I think it's a clarification question. The next question that I'm going to ask is, it is related to health equity data analysis. So does it mean to use some variables such as socioeconomic status or or ethnicity or gender? Are these variables, when we use it in our large data sets, can we say it as health equity data analysis, or what does health equity data analysis include other than these variables, and how do we analyze? Are there special techniques to analyze it, or it's just one perspective to look at data and get insights so that we can integrate or have specialized interventions?
Yeah, that's an interesting question as well. Now, lot of again, it's operationalizing variables, right? That's a very, very important part of health data analytics, because oftentimes, we have a lot of data, but we have to be able to make sense of it, right? For the problem at hand. So making sure that we kind of have measures. Again, there is no one size fits all, right? Even in health equity research. So to make sure that we isolate like measures and devise like constructs and concept that we are measuring in a way that really uh, is quite cogent for the context at hand, right? So social vulnerability index is one way, or one way that it has been now being done in the US. So it kind of takes a lot of different factors and a lot of complex
Yeah.
modeling of variables, including of course social determinants of health, because like I said, that those really form the foundation, right, of health equity
Yeah.
research. So yeah.
Okay. And I would like also to add one of the framework which is very close to me is intersectionality framework or intersectionality lens that can also, help
Absolutely.
understand. Yes, I think these are the tools that we can use in order to do equity analysis of
Yes, because
particular
yes,
health
people
program. Yeah.
absolutely, absolutely. People have multiple
Okay.
identities, right? That
Yeah.
plays into this complex, um, construct, so
Yeah.
to say. But yeah.
Yeah. So I now request all our participants who are in this call, so you can unmute yourself and ask questions directly to Dr. Dubey. I think I could see one hands raised earlier. So any questions? Can you see anything in chat box?
I
No.
do not see anything in the chat box here now.
Any questions that you want to write? You want to ask here?
Yeah, you could use the chat box too. Yeah.
Okay. So I think I can unmute. Okay, how do we unmute? I think I have to individually unmute. So any questions from this group? Any reflections or any experience sharing? Okay, I could see. Okay. Yes, Sam, go ahead and ask.
Okay. Good evening, Doc, and thank you for the opportunity. I just want to follow up on the question of how effective has public health experts been with the combat of COVID-19? In your estimation, how effective has public health experts been in combating COVID-19? Thank you.
Sam, thanks for the question. Can you please help me understand the question? I heard you say how effective has public health as a profession been in addressing COVID-19?
Yes. Thank you.
Again, thanks for the question. While it's a very broad question, um, again, to put like a statistic or a number, that may be, a little early, and it depends on what the specific question is. But the fact that public health has been, is involved with a lot of preventative approach has been the cornerstone of public health efforts in the U.S. Now, again, we know in the context of different countries it varies, but public health in general is really, it has really played a huge role. Definitely, no two ways about it. But in my assessment, it could definitely would have played a much, more, much better role, had we really empowered our public health system, provided it resources that it needs before the pandemic, right? So what we do in a pandemic, in a crisis situation, it's really a factor of how well prepared we are, right? How well we equip our systems, public health systems, with the resources that it needs to mitigate a challenge or to address a challenge of the scale and scope of this pandemic that it has been. So again, while we cannot change the past, we can definitely empower our systems, public health systems, better going forward. And that's the hope that I have, because public health departments have been chronically underfunded in the US and other places in the world as well. So I hope that that will change so that we are better equipped and better prepared, and we have people trained adequately to respond to such crises.
Thank you, Doc. I'm most grateful.
Yeah, and also I would like to add to it, if I'm allowed. Yeah. So I think there have been many examples of contextualized behavior change communication and community engagements, particularly in the context of COVID-19. So we did a scoping review of behavior change communication and community engagements in
Mhm.
low and middle income countries, and we could find out many examples of good practices.
Mhm.
However, the scale of these interventions were limited, and the sustainability was questionable because it was like response to crisis, and it these interventions were short-lived. So I
Mm.
think, from equity point of view, these interventions, the public health interventions particularly, in addition to medical interventions, should be sustainable. And I think
Mhm.
COVID-19 has in fact provided a direction to look into and think through health equity as an important indicator or an important goal from public health perspective. So I think we have another questions I can see in the chat box that has equity more to do with service provision or service utilization.
So both, right? It's difficult to isolate one from the other, right? But it also has a lot to do with information advantage, right? In making information related to services available, accessible in an equitable manner, right? And in the language, not only just the language, but in a mode or in a channel that people who need the information the most has access to it. Like meeting people where we are is the way I look at it, right? So it's even a step further than just service provision or service utilization. It's before the service can be even provided or utilized. It's about access to the information about the service. It starts with that as well, right?
Yeah. Yeah. So I think I have one comments related to the Sam's point that health equity is not possible. Then why should we talk about health equity? So perhaps I would like to highlight that perhaps there is a confusion between equality and equity. So when we talk about equality, that is equal distribution of resources, is something become very impossible because we have finite health resources across the globe. Not a single
Yeah.
country have all resources for health, but
No.
health
No.
equity is a possible goal because
Mhm.
here we distribute healthcare resources based on the need of the
Of the
healthcare
population.
services
Yeah.
and need of the population, and therefore health equity is achievable goal. And health equity can also be very important, a milestone for achieving universal health coverage.
Yes.
So I think
Absolutely.
I hope that point has clarified.
Yes, and similar to social justice goals, right?
Yes,
Those are also equally needed for everyone to realize their full potential, right?
true.
And this is vital for any nation state, any community, because when all of the people who live there are enjoy the best possible health outcomes that they can, that the nation can be successful, right? So
True.
um,
Certainly.
it is something that one has to invest in, right? It is something that will not just happen of its own accord because of the deep rooted structures in place, and so that's a worthwhile goal to have strive for health equity. Yeah.
Yes.
Thanks.
Yes.
Yeah.
Yeah, I think we can close. We have two more questions, but I think we can stop it right now.
Yeah.
So on behalf of Paro University, I would like to thank you, Dr. Dave, for sparing time and sharing your knowledge and wisdom with our students. And I think the session has been wonderful, and many of concepts have been clarified in a simple and lucid way. And as a token of appreciation, I would like to present a certificate. Is it visible?
Yes, it is. It is.
Yes.
Thank you very much. Thank you very much. I appreciate it. And I really appreciate the opportunity to share with the group at Parallel University. And thank you. Thank you so much, Dr. Pandya.
Yeah, yeah, and I also would like to thank our faculty members and all PhD scholars and MPH scholars who have participated in the Zoom link, as well as many of the participants are, have joined us through live Facebook. Uh, so thank you very much for all your participation and active engagement. I can see the way of responses you were providing to Dr. Dave's questions and the kind of questions that you have raised. I think that shows us, how much motivated and inspired you are, and that is something important reward for us.
Yes.
Also would like to extend my thanks to technical team of Para University, the PU webinar team, who has specially organized time even after the working hours of the university. So basically our webinars are planned between 9 to 5 Indian Standard Time, but considering the special request, they have organized this webinar especially for accommodating uh, uh, the requirement of international students and our speakers. So I really thank for their support. And before we plan for the next webinar, I would like to wish safe and healthy time. Take care of COVID-19 is still not gone, so we have to take care of ourselves, our family members. So take care, stay protected, stay healthy, stay positive. So with this, I would like to conclude today's webinar. Thank you very much.
Thank you, everyone. Thank you very much. Thanks for an engaged audience.
Yeah, and
I really appreciate that. Yes.
Yeah, and there is what demand from audience that we want such sessions, more of such sessions. So thank you very much, Dr. Dove, for your wonderful.
Oh, you are most welcome. You are most welcome. Thank you. Thank you, everyone. All right. Bye-bye.
Bye-bye.